It's a pleasure to talk to you guys today. Today I'm going to be talking about canine infectious diseases, and I have to say I really struggled when I was writing this talk because there are so many canine infectious diseases that could potentially have relevance in the shelter environment, and you always hem and haw whether I want to talk to you guys about the most serious infectious diseases, the most common ones, a combination of the two, and so hopefully I hit it right on the head and you guys get a lot out of this talk. So first off, why in the heck do you guys need to know about canine infectious diseases in shelters? And I'm sure you all probably know why you play an important role, but just to give you a little heads up of it, a shelter's mission ultimately is to provide animals with loving homes. And ideally, you want to get them into their homes as quickly as possible because it influences your capacity for care, it influences the health of your population, and everything else. And they get into loving homes faster when they stay healthy. As a staff member and a volunteer, you guys can help this process along significantly. You can learn to identify illness and notify medical staff when you're concerned that they might have something infectious. You can make sure that you aren't a fomite, which we're going to talk about what that means a little bit. And eventually, if you pay close attention to the talk, you talk to your medical staff, you can actually talk to adopters about what it means to have some of the illnesses that dogs or cats may have in your shelter. So what diseases are we going to cover today? Well, we're going to start with heartworm disease, which is a contagious illness, but it's not kind of the way in which you would think that normal infectious diseases occur. We're going to talk about canine infectious respiratory disease complex, kind of the big picture, the main players, the kind of more mild to moderate disease processes. And then we're going to talk about canine infectious respiratory disease complex when you talk about the scarier players, so kind of the two biggies. You've got canine influenza and canine distemper. And we're going to finish up with another big baddie in shelters that isn't super common, but you do see upon occasion parvovirus. So before I actually speak about all of these different diseases, I wanted to take a minute, and if you were in my zoonotic disease talk, you would have already seen these two slides, but it's super important, and so if you missed it, I wanted to make sure you got it. What determines whether an infectious disease is successfully transmitted? So there's many factors. There's the susceptibility of the host, so are they immunocompromised? Is it a little tiny puppy or a little tiny kitten, or a geriatric dog that may have an underlying disease you don't know about? What's the infectivity of the agent that you're getting? Does it take just a couple little particles of parvovirus to infect that animal, or does it take a massive load to make them sick? And are they being exposed in the appropriate route? Are they getting it in the fecal-oral route like they need to, or did they get it on their paw and someone cleaned it off, and so they were never actually exposed in the way that they need to be? So, speaking of modes of transmission, I'm going to be talking about them kind of in passing as I talk about each of the diseases. So I wanted to review them first. And again, if you were in my zoonotic lecture, you have already have seen this slide. But we've got indirect transmission and direct transmission. So for our direct transmission, we're talking about fomite or environmental transmission, or exposure to some form of contamination in the environment. We've got vector transmission, so this is going to play a huge role when we talk about heartworm in a little bit, but you've got fleas, ticks, mosquitoes that are serving as a vector. It may influence the life cycle or not, and it's transmitting that disease from one animal to the next. Now we've got airborne transmission, so it gets aerosolized out into the environment and travels through the air and can be inhaled, versus droplet transmission. A lot of people confuse the two of these. They assume that all respiratory disease are aerosolized, but in some instances, it may actually require a sneeze to the face. So you've got droplet transmission. The actual droplets of respiratory secretion are transmitted directly onto someone. Or you've got direct contact transmission. So your dogs in play groups, your puppies that are living together in a kennel, things like that. So we're going to start with heartworm, because it's not necessarily contagious in the way that everybody would presume. Heartworm is a filarial nematode parasite, which is a fancy way for saying a specific kind of worm that lives within the blood vessels around the heart and the lungs. It's found throughout the United States, but you can see based on this prevalence map that it's really heavily concentrated down in the south. And so if you're working in a shelter down in the southeast, I'm sure that you're highly familiar with it. If you're working with a shelter that has a transporter relocation program, you're probably also fairly familiar with it. And it has dogs as a natural host. So dogs are where the microfilaria and the heartworms themselves like to complete their life cycles. There are other hosts that can harbor it. There are cats, ferrets, and then wildlife as well. But mainly dogs, which is our concern in the shelter as well. In terms of transmission, it's an infectious disease, but it's not directly contagious from dog to dog. They require our little friend, the mosquito, and so we've got a heartworm positive dog that gets bitten by a mosquito, and they take up the little microfilaria, which I'm actually going to show you a video of later. The microfilaria live within the mosquito for a while, they mature, and then eventually they go and they bite another dog that hasn't previously been infected with heartworm. Once in the dog that has just been infected, those microfilaria and larvae actually mature into the adult heartworms, which then make their way into the pulmonary vessels and into the heart, causing disease. So some of the clinical signs associated with heartworm are when they're fairly early infected, especially if it's just the larval stages, you see no signs at all. When they have just a couple of worms, which this is obviously not a couple of worms, they show very few symptoms. But as they get a higher worm burden, they may get a mild persistent cough. They may become exercise intolerant, become lethargic, and they may have a decreased appetite or evidence of weight loss. And when you get a very large burden, such as the picture on the right of your screen, you can actually have sudden collapse and death because it's overwhelming the ability of their heart to pump blood through their system. So, how do we diagnose heartworm? There are multiple different tests. First, we've got antigen testing. If any of you have been around medical and you're checking your dogs for heartworm, it's frequently the little snap test where you put the blood in, you mix it with something, and it tests for basically little markers that are present on the adult worms that then get picked up by the test. There's also microfilaria testing. So you're looking for evidence of the small little babies that are living within the vasculature of the dogs and cats. And that is how that dog is then infectious to other dogs, because they can be bitten by a mosquito, which can then go on to transmit it to others. And I want to show you guys a little video. When you do microfilarial testing, you can either do a direct blood smear, which is what this is a video of. It's not as sensitive as others. If you have a really low burden, you may not see this, but it's really cool when you do. Oh, it is. I thought it was. Oh, can you see it? Did you guys see the little wiggles? I thought I had turned off the sound on it. So those little squiggles are these tiny little microfilarial parasites that are actually living within the blood, and they get taken up by the mosquito. And so that is also a way in which you can diagnose heartworm. Then another way you can do it is via radiographs. You'll see characteristic changes of the vessels and the heart on the radiograph. Again, not as diagnostic for specifically heartworm, but is helpful. Also seeing the little worms on an ultrasound of the heart, so echocardiography. And lastly, here's a little picture of what some of those snap tests look like. In terms of treatment and management, and this is where you guys come in and play a huge role as staff and volunteers, because you're responsible for the care of the animals throughout their stay in the shelter, including their well-being, playing with them, taking them for walks, and providing them with enrichment. One of the mainstays of heartworm treatment and management is restricting the exercise of positive dogs. They've got worms that are living within the vessels of their heart, and if they have too much exercise, it winds up overworking their heart and can lead to progressive illness for them. We want to start them on heartworm preventative because we want to make sure that we're killing the microfilarial parasites so they're no longer contagious via mosquitoes to other dogs. Your veterinarian will likely start them on a course of doxycycline. If you're treating the heartworm within the shelter, they'll start them on a course of doxycycline, which serves to make sure that the worms can't reproduce and that it weakens them. Then, before they do the main treatment, they should have their spay and neuter done. So they'll do any procedures that those animals might need because they're actually their most stable while their worms are still alive. And then lastly, they'll get an adulticide treatment. So this is one of the more common treatment courses that you'll get within the shelter environment. There's also a 3-course protocol or 3-treatment protocol that's commonly done in private practice, but may also be done in the shelter. And they get an injection with a melarsamine product. So it's an arsenical compound that serves to kill all of the worms in a fairly rapid succession. And then, just as important through follow-up, is restricting their exercise for the next 4 to 6 weeks. So you guys, if you have an animal that's in your shelter that's being treated for heartworm, you can talk to adopters about how important it is to restrict their exercise so that they stay healthy through their recovery. And then follow-up testing about 6 months later. So prevention is also one of the mainstays of preventing transmission of heartworm in the shelter and also keeping your entire population really healthy. So there's oral preventatives, and some of the examples are TriHeart, HeartGuard, and Ivomec or ivermectin, just generic oral ivermectin. You've also got Interceptor, Sentinel, and Trifexis. Some of them may be familiar to you, some may not. We've got topicals. All of these are given monthly. You could have Advantage Multi or Revolution. And then there is an injectable product that's less likely to be administered in the shelter. It's quite pricey, but it's called ProHeart 6. It's important to know that all of these preventatives are only effective against certain life stages. And so being a relocation partner, it's important to recognize this. And so lastly about heartworm, I give you this diagram that was actually drawn by a dear friend of mine. And it is really great to illustrate where heartworm preventatives are effective, when you can test for heartworm, and when there's this nebulous little stage that a dog has these teenage worms that you can't detect them with a test, and you can't kill them with treatment. And so if you've ever had, as a relocation partner, a dog that you adopt out that comes back heartworm positive, this is really great illustration to talk to those adopters about why there was no way that you would have known that that dog had heartworm to begin with. Because the heartworm prevention can kill the little baby microfilaria that are in the bloodstream, but if the mosquitoes bite them, take it up, and then deposit it into a new dog, you can still kill the next life stages, but that only lasts for about a month and a half. Once they get past this stage of L4, so maybe they were infected before they came to the relocation, to the source shelter, they were tested there, they were negative, they received preventative, but they were already beyond this point. We've got a whole bunch of little teenager worms that can't be detected and can't be killed. And so that's how animals can go on to test positive after adoption. Make sense? Does anybody have questions about heartworm before I move on?
Yes, if you use ivermectin or Advantage for flea treatment, is that also preventative treatment for heartworm?
Good. So the question, go ahead. Yep, so the question was whether the use of the Advantage flea treatment and ivermectin is successful against preventing heartworm. And so it depends on, there's Advantage and then there's Advantage Multi. Advantage is strictly a flea treatment. Advantage Multi has a second ingredient that also serves as a heartworm preventative. If you're using the generic, or not really generic, but the brand just Advantage, not Advantage Multi, but you are using an ivermectin compound or an oral heartworm preventative, that is successful for prevention of heartworm. Great.
That I originally had with my dog said the one particular brand of preventative was bad for my food. Is that true? Would that be possible?
So the question was whether specific preventatives can be bad for breeds. And that's a great question. You learn in veterinary school, white feet don't treat. Herding breeds can have trouble metabolizing some of the different macrocyclic lactones, which is the category that all of these medications are. And the truth of the matter is the level or the dose that you need to prevent heartworm or the infection of heartworm is actually really low. And so the likelihood of side effects from those breeds is actually pretty low as well. But if you are going to use off-label generic ivermectin, so it's a large animal injectable form, that is slightly more likely to have side effects if you're misdosing them. Thank you for the question. All right, no more questions? All right, we're going to move on to canine infectious respiratory disease. So this first section, I'm going to talk about kind of the big players, the more common players that cause what you would generally see in infectious respiratory disease. And so the layman's term that a lot of people use is kennel cough. We don't really like that because you can see this infectious respiratory disease complex in places other than kennels, but still this name persists. And so a lot of times, if you say canine infectious respiratory disease complex, people will look at you like, oh. But if you say kennel cough, it makes much more sense. This disease complex is caused by a multitude of infectious agents. They're usually viruses or bacteria. It's a multitude of bacteria as well. So Bordetella is one of the main ones that everybody thinks of. We've got Mycoplasma. There's Streptococcus epidemicus, which can cause very, very serious signs that we're not going to cover today, but can actually be one of the scarier players as well. And then secondary bacterial and pathogens. It's important to note that a lot of these bacteria, they can cause kennel cough on their own, but they're also found as normal respiratory flora in dogs that aren't showing any signs. And then we've got our viruses. We've got parainfluenza, adenovirus, respiratory coronavirus, herpes virus, and pneumovirus. You'll see I didn't put two of the bigger, scarier pathogens because I'm going to talk about them individually, but you've got distemper-virus and canine influenza as well. And so all of these guys work kind of together. You can have one by itself or two or three. If you've ever done a respiratory PCR panel, you'll notice that they all kind of work in concert sometimes. So kennel cough is generally transmitted via aerosol transmission. So think your barking dog, your coughing dog that's coughing out into the air that can spread up to about 25 feet in its own right. Aerosolizes, and other dogs that are also barking or that are just kind of laying around and breathing can also get that disease. They can also get it through direct transmission, so maybe playgroups. I'm not harping on playgroups, I'm a huge fan of them, but it is a means of direct transmission from dog to dog. And most importantly for you guys as staff and volunteers, all of these diseases can be transmitted via fomites. They're not the strongest infectious agents that exist in the shelter, but they can still last anywhere from 12 hours to a couple of days. And so if you're snuggling on a dog that has respiratory disease and then you go down a few kennels to the next dog, if they weren't barking and exposed via aerosol, you can actually transmit it as a fomite. And so examples of some fomites that exist in the shelter are your mop with your dirty mop bucket. You've got doorknobs, so you pet a dog or it licks your hand and then you go to leave or you walk into your office. You've got this wonderful dog who maybe he has kennel cough and he coughed on his leash and the chair he was sitting on while he was in the play yard. Or maybe you had to make notes about your interaction with that dog and so now your pen could be infected. We've got little stuffies if you play with them. If you don't have them for each individual dog, that could be a fomite. And you can be one of the number one fomites yourself. So snuggling with a dog, not changing your shirt, or not paying attention to how that dog interacts with you, you could actually serve as a vehicle for disease transmission. So I want you guys to help me out here because I hate just talking at you guys when I'm presenting. What are some of the clinical signs that you might see for a dog that has kennel cough? Good, so I've got lethargy. What else? I've got one person, come on guys, it's called kennel cough potentially. Good, coughing, sneezing, nasal discharge. Sometimes they'll have a mild fever. And that's basically the signs you'll see. Sometimes you'll see worsening signs, and a lot of times it's associated with introduction of a new pathogen that hasn't really been in your population. And most of the pathogens that we talked about a couple of slides ago have an incubation period of about 2 to 3 days. And so you'll have a dog come in, they're barky, and maybe like a week in, they've already been exposed and they've started coughing. And thankfully, with kennel cough, with most of these signs, mortality is generally pretty low, with a few exceptions. So how do we diagnose canine infectious respiratory disease complex? I can say, in general, in the shelter environment, it's usually just treated with supportive care, and you diagnose it empirically based on their clinical signs and exam alone. How many of you guys have diagnosed kennel cough in that way? Good. So, or you've went to your veterinarian that works within your shelter and said, hey, this dog is coughing. And they have a protocol in place that is generally how you treat your coughing dogs. If you really need a specific diagnosis, it may be because the disease course isn't typical for what you see within your shelter, or it's lasting longer, or suddenly a larger number of dogs are experiencing these signs. You can do testing such as PCR panels to actually figure out which of those bugs that I listed is actually having the potential to have caused the disease. It doesn't give you a dead ringer because, again, I talked to you about how they can be normal flora in a healthy dog sometimes. But PCR definitely helps if you have a change in what's happening in your population. So, treatment and management. You need to isolate coughing dogs. I know it can be difficult. There are some places that struggle to have separate areas, but at a minimum, if you don't have separate isolation with separate ventilation systems, you should be separating your sick population from your healthy population by at least 25 feet because you want to make sure that they're not exposing each other. You want to monitor their signs, provide supportive care, and antibiotic therapy as indicated by the medical staff. So your veterinarian will decide at their discretion whether something like doxycycline might actually be helpful. And then you want to have careful management following the completion of their therapy if they got antibiotics or if they've just stopped coughing, because some of the infectious agents can actually remain contagious beyond the cessation of clinical signs. All right, so how do we prevent it? In general, we do have vaccinations, so we have kind of Intratract 3 or intranasal Bordetella combination vaccines that get Bordetella, adenovirus, and parainfluenza, or maybe it will be a combo of just the two or just solely Bordetella. But in most cases, it doesn't completely prevent the disease. What vaccination for these diseases, for this complex will actually do is decrease the severity potentially or the duration of clinical signs and potentially even decreasing shedding. What's really important is proper cleaning of your environment, and that goes for if you have an animal that gets adopted out and you have a new one going in, you want to make sure that you're following appropriate contact times and disinfection and everything. For a dog that's living in their kennel, it may just mean that you're doing spot cleaning. You want to reduce the stress of your canine population. Stressed dogs, barky dogs, really anxious dogs, it has an effect on their immune system, and it has an effect on their respiratory tract if they're barking and barking and barking all the time, and it can predispose them to respiratory infection. You want to prevent irritation of their airway. Again, decreasing their barking. Barking dogs are more likely to get their respiratory infection. And not only that, you should be using, I didn't put anything besides decreased barking, but you should make sure that the concentration of the chemicals that you're using in the environment isn't at an excessive concentration that will irritate their airways. And also a huge mainstay for preventing respiratory disease within your shelter environment is to operate within the capacity for care of your shelter. So making sure that you don't have more dogs that you can adequately care for, more dogs that you can provide sufficient enrichment such that they remain healthy and low stress. And you want to make sure that you're getting them out as quickly as possible. Any questions about kind of the generic overview of canine infectious respiratory disease? No. All right, so now I wanted to go a little more in depth into two of what I dubbed the scarier players, because as a shelter vet, I never really want to hear about having canine distemper or canine influenza in our shelter. But we know that it is a fact of life in some shelters, and there is higher prevalence in some areas than others. So I'll start with canine influenza. And I probably won't do it as much justice as Dr. Janesco just did next door in the previous hour. But I'm going to try and touch on the basics for you guys as staff and volunteers so you can understand your importance in this game of disease prevention. So there's two strains that are currently circulating through the United States that we worry about. We've got H3N8 that's been around since about 2004. And we've got H3N2 that was discovered in the United States through the influenza outbreak that happened in Chicago in 2015. I'm sure you guys, I hope you're familiar and have heard kind of through the news and all of that. But risk factors for introduction into a shelter of this disease are that, one, you have influenza in a community that your shelter is residing in, or you're transferring dogs from a community where the virus is present. This is the latest map from dogflu.com, which is run by the producers of vaccines, that shows you where the disease is prevalent. So we've got the H3N8 is the yellow ones, H3N2 is the middle kind of hued orange, and then the darkest color is where both strains of flu are actually present. So you'll notice there aren't many places where there haven't been cases of flu, but there are definitely bigger hotspots, like the metropolitan areas in New York, Florida for H3N8, and some of the other more highly dense populations. Since canine influenza hasn't been circulating around for as long as a lot of our other players, roughly 80% of dogs exposed to canine influenza will actually go on to develop clinical signs. And 20% of dogs, which I think is slightly more terrifying, 20% of those dogs may shed and actually have no signs whatsoever. So what are the clinical signs of influenza? They're often not very different from canine infectious respiratory disease complex. And so you may go on for a little while not knowing that you have canine flu. They usually have a cough that may persist 10 to 21 days, just like other infectious respiratory diseases. They might have sneezing. They may have nasal discharge that it might be purulent or it may not be. It may just be a serous discharge. They may have ocular discharge or not. They might be lethargic and anorexic. They might have a fever. And that sounds very similar to what I just talked to you guys about with infectious respiratory disease complex. But in some cases, for some dogs, they may actually become more severely infected. And so you may wind up with a dog that has pneumonia, and it might have a hemorrhagic component. And if you don't know what that means, it means that a dog goes from happy-go-lucky in their kennel and doing really well to coughing up blood and subsequently passing away, and sometimes in a horrendous scene that's a pool of blood. And so it doesn't happen very frequently, but it's possible. Flu dogs may also have a really high-grade fever. So they're these dogs that are burning up, they're really lethargic, and they're really just not doing well. And they may have an increased respiratory rate and effort associated with their pneumonia. And in up to 10% of cases, which that's a very high end, usually it's about 5% of dogs may die as a result of canine influenza. So transmission, it's the same as canine infectious respiratory disease complex. So we've got direct contact and aerosolization of the influenza virus up to about 25 feet unless it gets carried farther by your ventilation. This can happen in the shelters that may have the very large box fans that are blowing from one dog to the other, serving to kind of help it travel a little farther. And then again, you guys as fomites. So H3N8, the older of the two strains, has an incubation period of about 1 to 5 days, and most cases actually appear in the 2 to 3 day window, just like other infectious respiratory disease cases. H3N2 has roughly the same incubation period, maybe a little shorter, maybe a little longer. But most of the dogs, they're most contagious during their incubation period, and so they will shed the virus even when they're not showing signs, which can happen with the other disease processes as well, but I think makes it a little scarier. So diagnosis. Again, diagnosis of respiratory disease within shelters is frequently only sought when there is a change in the normal respiratory rates. There may be surveillance that's done where you do intermittent panels as veterinarians to see what happens. But I have this little infographic for you guys that actually came from the University of Florida showing how you can actually sample for respiratory panels and for disease testing for influenza. So we've got nasal swabs. They can do a swab of the conjunctiva because a lot of times you'll have virus secreted there, in the oropharynx, so in the back of the throat, and then you send it off and they'll do PCR testing. So the question is canine influenza a progression of kennel cough? And the answer is no, it is a player within kennel cough, or infectious respiratory disease complex. It's one of the ones that is a hot topic because there have been outbreaks because it's been transmitted and kind of translocated. And it scares a lot of people, so I wanted to talk to you guys about it. But really, it falls within that same infectious respiratory disease complex that all of the other bugs I just talked about do. So treatment and management, again, you want to isolate. You want to isolate your coughing dogs and make sure that they are separated from your healthy population. If they're mild, like most cases of infectious respiratory disease complex, you may provide supportive care. Again, it's a virus, and so antibiotic therapy isn't actually going to be killing the influenza. It's used at the discretion of the veterinarian to prevent secondary infections. And if it's a more severe pneumonia, they may require hospitalization, more intensive supportive care, or euthanasia if it's really beyond the capacity for care of your organization. If it's not something that you can treat fully and provide adequate care to that animal, it may not be in the best interest of that animal to be treated. And animals, especially those that have H3N2, should remain in isolation beyond the end of their clinical signs. If you have a diagnosis of influenza, if you want to break the cycle of transmission, they need to remain through their infectious period, which for H3N8 is usually only about a week to 10 days after clinical signs. But for H3N2, the newer virus that's been introduced, it's actually 21 days or potentially even longer than that. So prevention, again, isolating your coughing dogs. Even if you don't know if you have influenza in your shelter, it's best practices to remove your ill dogs from the population. As a staff and volunteer member, you don't want to be a fomite. You want to make sure that you're practicing good hand hygiene, kind of shirt hygiene if you're interacting with a crazy dog that's kind of rubbing his nose all over you or potentially contaminating you if he's got infectious respiratory disease. You want to work really hard to decrease the arousal and stress levels within the kennels. So decreasing the amount of barking dogs and all of those things to keep them happy and low stress in the shelter. And again, and this isn't something that's necessarily within your guys' means to do as staff and volunteers, but stressing that we do operate within our capacity for care of our organization and trying really hard to decrease the length of stay of animals so that they're not sitting in the shelter incubating disease and having the possibility of transmitting it to others. Again, just like CERD-C, proper cleaning of the environment and influenza, thankfully, and most of the respiratory pathogens are actually really easily killed with routine disinfectants. And then there's always this question about vaccination. And Dr. Janesco said it best in the last lecture, but in the shelter environment, it really depends on what your population looks like, how long these animals are staying in your environment as to whether canine influenza vaccines are actually useful. It is a killed vaccine, so it does require a booster. It's not like our general modified live vaccinations like we see for parvo or distemper, where we think that even getting one vaccination into them at the time of intake will help with the disease course. And so canine influenza vaccines are really, I would say, only recommended if you're living in an endemic area, that you really do worry about flu exposure, and you do have a population of animals that will be able to receive the booster vaccination. They're very costly, and if you have dogs that are going through your shelter within about a week, and then they go into a home, if they don't get that booster vaccination, then it's like they've never been vaccinated. So even if they come back to your shelter again and you vaccinate them again, it still doesn't render protection. Does that make sense? All right, and are there any questions about canine flu before I move on? No? Okay. So distemper. I think it's also one of the bigger, scarier bugs. May also be because I'm in a shelter from the Northeast, and so we don't see it necessarily as much. But it is a virus that infects dogs, raccoons, ferrets, and big cats. But most at risk in our canine population is young puppies and adults that have absolutely no vaccine history at all. What I find the scariest about distemper is that it has a really long incubation period in some cases, and it can be up to 4 to 6 weeks. In some dogs, it's a lot shorter, but it's always kind of intimidating when you've got a dog that you thought was healthy all along and they break with actual fulminant distemper signs. Thankfully, distemper is actually a virus that's easily disinfected by all regular disinfectants. So, distemper's clinical signs, it can appear identical to your run-of-the-mill kennel cough or canine infectious respiratory diseases. They'll have nasal discharge, coughing, sneezing, and may never even really have much of a fever. But frequently, they'll actually have progression of the disease where they have the potential for pneumonia or more severe, serious respiratory disease signs. They may or may not go on to have diarrhea and or vomiting. And I think really the scariest component of distemper is when they wind up with neurologic signs. So they may have weakness or paralysis, vestibular signs, so they're falling over, kind of circling, not really good at moving around. Myoclonus, which I'll show you a video of it in just a minute. And this is actually a really mild case, which is muscle twitching or involuntary contraction. And it can happen diffusely throughout the body and not just in a focused area. They may have hypersensitivity, neck pain or rigidity, and they may wind up having behavioral changes or seizures. These dogs may also have eye lesions or skin lesions. They can have a dermatitis. But most frequently, these are the ones that you'll see the most in fulminant distemper cases. I hope I have the sound of this. So you can see the twitching on that dog's forehead. He had a history of being taken off the streets as a stray, and about 6 weeks later, he had had kind of some respiratory signs and then some nebulous GI signs, and then progressed with the myoclonus. My least favorite part of this video is the person handling the dog without gloves. So please don't do that, especially if you have a dog that may have distemper, but it's a good example of what myoclonus looks like. And asymptomatic infections are completely possible. And this is more common in a dog that may have been exposed to distemper very soon after they received their vaccination. So say they received a modified live vaccine, which is fairly protective within about 4 days. So if they're exposed within that 4-day window, they may have either mild signs or minimal signs, but can still be shedding the virus. So how is it transmitted? I'm going to ask you guys. What do you guys think? How do you think distemper is transmitted? Good. So very similar to canine infectious respiratory disease complex. And that's the most common means, but it's actually shed in all of the body secretions. So urine, feces, coughing, respiratory secretions. But by and large, especially in a shelter environment, barking, coughing dogs can spread it via aerosolization. And the shedding for distemper virus, like most of the other respiratory pathogens as well, sheds prior to clinical signs. You can also get it via direct contact. So your dogs that are playing either through their kennel bars or in a play group or out on a walk having a little play date. Respiratory droplet transmission and via you guys as fomites. Distemper doesn't live very long in the environment, but it is long enough that on one day of or shift of volunteering that you have a couple of hours, you walk a few dogs, you can transmit it from one dog to another unless you're very careful. So diagnosis, frequently, and I found in more endemic areas, it's diagnosed via clinical suspicion given the progression of clinical signs. This is an example of one of the dogs that has one of the slightly more common dermatological lesions, if they're going to have it. It's kind of hyperkeratosis or kind of overgrowth of the pads in the nasal planum. But you can also do something like PCR, or it's a common thing on the respiratory panel, or you can do virus isolation, plenty of other things. It's something that if your veterinarian has a suspicion for distemper going through your shelter, we do recommend doing diagnostic testing. And it can also, unfortunately, be diagnosed at necropsy if you have a dog that isn't able to be supported through their illness, or it's such that you can't manage to have isolation within your shelter. Necropsy is a way for it to be diagnosed as well. So this is another lesion that can happen if you have a puppy that survives distemper virus prior to the development of their adult teeth. So if they have distemper and they survive it before they have their adult teeth, they can have what's called enamel hypoplasia. And you can see kind of the lines on their teeth, and that's because the enamel of their adult dentition isn't actually fully formed. So how do you guys think we can best manage or treat distemper? Let's go with manage first. It's a recurrent theme in my lecture. Good, you want to isolate coughing dogs. You isolate. Dogs that have fulminant distemper need intensive supportive care based on the symptoms that they're showing. So they may need nutritional support because they're anorexic. They may need support with secondary antibiotics because of secondary bacterial infections. They may need antiemetics, so anti-vomiting drugs if they have horrible GI signs. And their prognosis through this treatment and management really depends upon the type and the severity of their signs. dogs that have progressive worsening neurologic signs do not have a great prognosis for return of quality of life, versus there are plenty of distemper dogs that maybe they're adults that have a later in life infection, that they've had one vaccine and they were exposed fairly early. They may just have mild respiratory signs. They may just look like your standard run-of-the-mill kennel cough dog, and they're isolated and supported, and maybe you did a respiratory panel and they came back as distemper. And so they're isolated for their appropriate period, and they actually go on to live perfectly normal lives. Recovering dogs from distemper, if you have diagnosed distemper in these dogs, they have to remain isolated until you've confirmed that they're no longer shedding the virus, because they can shed virus for up to 4 months, but most frequently, it's only about 6 weeks after the cessation of their clinical signs. The best way to do that is through a urine PCR or through respiratory swabs as well for PCR to show that they're not shedding the virus any longer. So what do you think the best prevention for canine distemper is? Good, vaccination. Vaccination of dogs with a modified live canine distemper vaccination is one of the mainstays for disease prevention. And even if you've got distemper within your kennels and they're receiving it at intake, within about 12 hours, they can mount a response such that they only progress with mild respiratory signs and don't progress to myoclonus, seizures, and neurologic signs. Prevention, you want to isolate your coughing dogs. The best way to prevent diseases from spreading within your shelter is to isolate the dogs that are ill. As a volunteer or a staff member, you can make sure that you're not a fomite. You're not getting your shirt contaminated and snuggling every single dog. I know I love snuggling dogs, but kind of treating them all like they might have a little bit of contagion. I was always taught by one of my mentors in veterinary school that you should actually handle puppies like they're covered in a pound of poop, right? So maybe you snuggle them a little and you're like, I love you, but now I'm gonna go wash myself off. Or I'm gonna change my shirt before I interact with anybody else because I don't wanna hug my friend when I poop on my shirt, right? Another thing you can do is not to mix litters of puppies, both literally and figuratively. So via fomites, being a puppy snuggler, you don't want to go from one litter to the next and snuggle every single one of them, because if one litter of puppies has something that's contagious, you don't want to spread it to the next one. And then just like I said for the other respiratory disease complex pathogens, is you want to try and decrease arousal and stress within your kennels. Barking dogs, coughing dogs, more likely to cough, more likely to spread, more likely to contract respiratory diseases, including distemper. And operating outside of your capacity for care is also more likely to generate disease and increase the incidence of disease in your shelter. Additionally, lastly, proper sanitation, just like I said for all of the other infectious diseases. It's easily killed with most routine disinfectants. It doesn't live too terribly long in the environment, but you want to make sure that you're cleaning and sanitizing properly. All right, any questions about distemper before I move to parvo? Yeah.
Like in our shelter, we had a transport of 13 puppies into our shelter. We had divided those 13 puppies into various fosters. We had one group of fosters, they took 6 of them. Of that 6, one had distemper. No, was she by herself? She was by herself, but nobody else had gotten it. So it must be she was exposed. That's what we were trying, because we went through
all those puppies, there were 2 litters, but they came from the same household. And the people that had them previous to us getting them couldn't tell you which one belonged to which mom.
Okay, so the question was that their shelter received a transport and it had 13 puppies on it, and one puppy went on to contract distemper, and none of the other puppies did, when you had to assume that they came from the same household, they were all likely exposed. What I can tell you, the likely story behind that is not necessarily that only one of them was exposed, but that one unlucky soul did not have sufficient maternal antibodies.
So that one particular puppy had a blue eye and a brown eye. Does that play into anything? I know sometimes 2 different colored eyes can play into weird things going on with the puppy.
So the question was whether the one puppy's unique characteristics regarding its eyes would have influenced it, and I would have to say that the likelihood is pretty low. I think it was likely the kind of taking in of maternal antibodies and the protection that that puppy actually did not wind up having compared to its siblings. Whether it was that maybe it actually had more maternal antibodies and it got a vaccination and didn't respond, was then exposed and went on to develop disease, or they didn't have the maternal antibodies that they needed and they went on to develop disease. Any more questions? All right, so lastly, we've got parvovirus, who's another baddie. I think it's a pretty picture. That's what parvovirus looks like. It is a virus. I'm sure you're all familiar with parvo. Who knows what parvo is? I guess I should check really quick. Good. So parvovirus is a virus that attacks rapidly dividing cells. So in most cases, that's the GI tract and the bone marrow, which is why we get the signs that we do that we'll go on to talk about in a minute. It's shed in the vomit and the fecal material, which also gives you an idea of where we're headed for what the clinical signs are. Has a pretty short incubation period. Usually it's somewhere between 3 and 5 days, maybe 5 to 7, but it can be as long as 2 weeks. Parvovirus is kind of a booger in that it can actually survive up to a year, sometimes even longer in the right environment, the right kind of circumstances. So for those of you that have seen parvovirus, what are some of the clinical signs that you'll see? Good, so we'll see vomiting and diarrhea, lethargy, anorexia. Good, loss of appetite. They may be febrile or they may be hypothermic depending on what kind of disease course they're experiencing, what effect that the virus is having on the body. So we've got lethargy, inappetence, nausea, vomiting, diarrhea, plus or minus fever. And it's typically the puppies that we see it in. You can see it in adult dogs or juvenile dogs that are kind of outside of the range of puppyhood, but in most cases, it's our young puppies. Parvovirus is transmitted. It starts shedding prior to clinical signs, which is another one of those things where we're like, and I encourage you to handle puppies like they're covered in a pound of poop in case they might have parvo. It can be spread via direct contact with the infected animal or direct contact with the infected feces or vomit. And also, my favorite mode of transmission, fomites. So you guys can be vehicles for transmission of parvo because it's pretty hardy in the environment. Your mop bucket, if it doesn't have sufficient disinfectant, can also serve as a mode of transmission. Any of the toys that lay around, transmission, fomites, fomites, fomites. How's it diagnosed? Frequently in shelters, it's diagnosed via a cage-side test. We've got our SNAP test that's done on fecal material. And sometimes, if that turns up negative and your vet still has a clinical suspicion, you can see some characteristic changes on blood work with the same clinical signs that you would expect to see with parvo. So how is it treated? Again, isolate your ill animals. You want to quarantine all exposed and at-risk dogs because depending on what their kind of immunity level is, you want to make sure that you're monitoring them to make sure they don't break with disease. Parvovirus, in general, the way you treat it is through supportive care, symptomatic care. You want to make sure that you're preventing them from vomiting. You want to try and decrease their signs associated with a GI irritation. You want to support them through the potential for secondary infections because it attacks the bone marrow and affects their immunity and their ability to fight off infections. And you also, just kind of a little tidbit, you really shouldn't ever be isolating parvo puppies near kittens, because the likelihood is fairly low, but feline panleukopenia is also a parvovirus, and so there have been some anecdotal evidence that parvo puppies may actually expose kittens and they can go on to show signs that are fairly consistent with feline panleukopenia. All right. So prevention. How do we prevent parvovirus, guys? Vaccinate, vaccinate, vaccinate. So even if they're injured or moderately ill, the immune response to parvovirus vaccination via modified live can start working very quickly, especially if a dog doesn't have any prior, doesn't have maternal antibodies interfering. Additionally, you don't want to be using areas that are really difficult to disinfect for puppies. Any puppy that may not have adequate immunity to parvovirus, you don't want to be bringing them into areas that aren't easy to disinfect. Not only because there may be an adult dog that just had mild disease and you can expose them to other diseases, but also because if you have a parvo puppy, break with parvovirus and they've been shedding into that grassy area, then it's kind of out of commission for all of the other animals. Ideally, you should be keeping your puppies out of areas that are frequented by adult dogs. Again, because adult dogs have a higher level of immunity to all sorts of infections than puppies do. And just like distemper, you don't want to be mixing litters of puppies, both literally and figuratively, via fomites or direct transmission. And proper cleaning of the environment. Unlike all of the other infectious agents we've talked about today, parvovirus is kind of resistant to being disinfected by things. You want to make sure that you're using something that actually is appropriate for parvo, such as Rescue or Excel, the accelerated hydrogen peroxide, Virkon or Trifectant, and household bleach. The quaternary ammoniums that smell really nice, they don't actually do the best job of killing parvovirus. Any questions about parvo before I move on to my last little pearls? Yeah? Okay. So my final pearls of wisdom for you guys as volunteers and staff is don't overexert heartworm-positive dogs. If your veterinarian diagnoses them with heartworm, and you see or you find out they've been diagnosed with heartworm and they forgot to put up the exercise restriction sign, don't take them and run them around the playground because we don't want to have them have their heart overexerted. Operating beyond the capacity for care and prolonging length of stay increases the risk of infectious disease in our dog population. Same goes for cats, but we're talking about dogs today. You want to isolate all of your coughing dogs. It's my recurrent theme throughout this entire talk. You should be isolating your coughing dogs away from your healthy dogs so that you're not potentially exposing your healthy dogs to illness. Parvovirus is really hard to kill, and so you don't want to put puppies in difficult to disinfect areas. And don't be a fomite. As a staff member and volunteer, if there's one thing you really take away, is that you should think of yourself as a potential vehicle for disease transmission and make sure that you're doing your best to prevent that. And by learning how to recognize all the infectious diseases, you can help keep your shelter canine population healthy by really communicating with the medical staff and being an extension of what they can do, because your medical team is usually fairly small, and if they have you guys out there as sentinels and kind of little detectives investigating everything, you can do a lot to help their population as well. All right. With that, are there any questions? All right. Thanks, guys, and thank you to Maddie's Fund because they do so much for all shelters, our program, and everything. All right. Thanks.